Hello everyone. I am Dr. Berkkkaratas. Our topic is the penis Doppler test. It is a test for measuring blood flow to the penis. It is a test that we want in some patients, especially in patients in erectile dysfunction. Before 1990, it was widely practiced, but with the advent of drugs, the application of these tests gradually decreased. Today, we want this in very few patients. So who should we do this test for? A person has erectile dysfunction despite taking medication and takes medication for it, but still does not have erectile dysfunction. We need to apply a penile Doppler test to these people. This test can also be done to see the blood flow to the penis, especially after surgeries, such as prostate cancer surgery, rectal cancer surgery, or cancer surgeries performed in that area, or after major surgeries. In fact, the question is not to whom it should be done, but to whom we ask who it should not be done. For example, there is no indication of premature ejaculation. It is not the right approach to say that penile Doppler test is not performed in patients who do not ejaculate prematurely, or that let's look at our vein and do this Doppler test because some hardness has decreased in patients who have self-erection in patients with erectile dysfunction. The first thing to do in patients with decreased erection is medication. So why did the Doppler test decrease when drugs were used? Here's why. When we take the drug, the mechanism of action of the drug is to increase blood flow and dilate the vessels of the penis. That's what it does. If a person has erectile dysfunction and this is due to a vascular reason, he will benefit when he takes medication. In other words, if there is a problem caused by the artery, caused by the blood supply, then it will benefit when it takes medication, and this time we need a Doppler test. The problem is obvious. The problem is an arterial problem, but if a person's erection does not improve even though he takes medication, then the problem here is not in the artery, that is, not in the blood that comes in, but in the outgoing blood, that is, a Doppler test should be performed to detect a venous leak. What do we look at in the Doppler test now? Not all veins of the penis are examined. The penis has 3 arteries, so here it comes in, it's just one artery over there. 3 of them are leaving. We are mostly looking at the artery that passes through the penis, which we call the corpus cavernosum, that is, in the places that swell during erection. These 2 arteries are being looked at. Obviously, these are being evaluated. Now how is this test done? It is an easy test, but before the test, it is absolutely necessary to give an erection drug into the penis. That is, it is necessary to make a needle. Therefore, after making this injection, the blood passing through the arteries of the penis is measured at 5 minutes, 10 minutes, 20 minutes. In other words, we can say that it is actually a simple and easy test, except for the needle. Now this can be very complicated. I'm not going to say too much about that, but what we just saw is the artery and the branches of the artery that provide the main blood supply that runs through the penis. In this way, they are displayed with the method we call Doppler. Now, a systolic flow and a diastolic flow are measured here. What does that mean? Don't get too confused. For example, put your hand there and you will feel your artery, or you will feel your heart beating. The part that hits your hand, that is, throws it, we call it systolic current. At that time, the blood rushes through the vein. There is also the part that he does not throw, that is, the part that you do not feel, and the diastolic part, that is, the resting part. So, obviously, there is a work part and a rest part. Now, when the data here is looked at with ultrasound, the result is obtained by Doppler. Look, the top part here is where the full vein beats. As you can understand, this is the rest part. The flow rate of the blood at that time should be above 35 centimeters per second in a normal person. If it falls below 25, we are not able to take care of it. In other words, we say that the blood does not come to the penis enough. So what should happen during this rest? This should be under an average of 3 to 5 centimeters per second during rest. The ideal is 3 centimeters under a second. If this is more than 5 centimeters per second, then we call it a leak. Or it is called venous leakage. Therefore, of course, if the venous leakage is excessive, for example, if it is 30, the incoming blood, the passing blood is 30, that is, 30 in the stoic and 30 in the leak, then there will be no hardening. So, frankly, we can say that the higher the peak, the lower the part here, the better the hardness. Of course, it is difficult to explain the technical subject. I hope I was able to explain it. Is it an innocent test now? It's not an innocent test. Of course, if it is done to the appropriate people at the appropriate time, we do not actually see any complications. But especially for patients with spontaneous erection, let's take a look at the vein. Is there anything or not, or if this test is performed on patients who have little erection loss and have not tried any drugs yet, we come across a situation that we call priapismus, that is, the hardness does not disappear due to the drug we make into the penis. It is a serious condition. I propose the following. I do this with my own patients. When I send it to the radiologist for Doppler, I write down my phone number and give it. Because if the erection does not go away within 2 hours, it is absolutely necessary to contact the doctor. If it still does not go away at the 4th hour, it is absolutely necessary to intervene. Otherwise, there may be blood supply disorder in the penis and irreversible damage. When we say we will treat it, we may suddenly encounter a worse situation. This is quite important. In other words, if you are going to have a Doppler test, it is very important that you are in contact with the doctor who wants it. Of course, bruising and redness at the injection site can also occur when the needle is made from the hip. This is normal. There may be pain, especially in patients who do not have erection for a long time. Serious hardening can occur when this test is performed. Or there may be hardening. If there is such a situation, it may cause pain and pain may occur due to the drugs used. These are also very important. That's all I want to tell you about the Doppler test on the penis. It is a very useful test if it is done properly, that is, if it is done at the appropriate time in the appropriate person. But first of all, we recommend that people who do not have erection try medicines, and then if it is useless, we recommend that a balls test be done. Thank you.